Senate 2146, Senate 1333, an act prohibiting non-consensual intimate examinations of anesthetized or unconscious patients. Yes, we are actually saying we need a legislation for this. Okay. I will, Amagini Goddard and Ari Silver-Isenstadt. I have you listed as a panel. Are you both on Teams?
Yes.
Okay, you have a total of 6 minutes, so how you share that time is up to the two of you.
Great.
And are you both here? Ari, are you here?
Yes, I'm here too.
Okay, great.
All right, I think I'm going first. So, good morning to you, Chair Decker, and to the members of the committee. My name is Ari Silver-Isenstadt, and I support H.2146, S.1333, an act prohibiting non-consensual intimate exams of anesthetized or unconscious patients. I'm a pediatrician based in Baltimore, Maryland, and I co-authored one of the significant studies about consent practices for educational public exams in the United States. This research has been highlighted in At Your Cervix, a new award-winning documentary. I'm asking for your help for my patients, my students, and my profession. 30 years ago, when I was in medical school during my gynecology rotation, I was expected to hone my pelvic exam skills on already anesthetized women. It was clear to me that these women did not know I was there for my own educational needs, and that my teachers expected me to use their intimate parts as my classroom without their knowledge or permission. I refused and was brought before the deans. I felt my medical education was threatened. I had a choice to make. Do I do what they wanted and graduate, or defend my integrity? Ultimately, I took time off and did research. Our study revealed that 90% of the surveyed medical students from the 5 Philadelphia area medical schools practiced pelvic exams on anesthetized patients for educational purposes during their OBGYN rotation. I emphasize this number, 90%, because this is how many medical students learn. Our research also found that the importance medical students place on informed consent erodes as they progress through their education. I found this with my own classmates. Initially, many agreed we needed permission to examine patients. As we went farther along, more responded with statements like, if we ask, they may say no, and how will we learn? I believe that people outside of medicine see this problem more clearly. It seems obvious that people should be able to explicitly authorize how their bodies are going to be used and by whom. For the last 20 years, I have taught medical students. Students have cried in my office, worried about how the patients would feel if they found out the student did what they did. We need you as legislators to help put an end to this offensive and embarrassing training practice. As a medical profession, we have been unable to do this ourselves. Arguments against getting explicit consent fall flat under scrutiny, and research shows that patients are willing to provide consent to these examinations, but they want to be asked. Patients' trust in physicians is crucial for successful health outcomes. Without it, patients may delay seeking care. Don't we want our physicians to value truth-telling and to respect our bodily autonomy? Why do we accept a training model that indoctrinates the opposite? I want my profession to stop training practices that hurt both patients and students. I hope you will help all of us and vote favorably on this bill.
Good morning to the chair, members of the committee. My name is Amanda Goddard. I'm the director and producer of At Your Cervix, and I'm here to provide testimony on H.2146, S.1333, and we want to thank you for advancing the bill last time, and we hope that you will vote to advance it again, knowing that this bill is more inclusive and can benefit more Massachusetts residents. I am a reproductive health educator. I taught in medical schools for 10 years, and I've been researching this issue for 18 years, and I've interviewed hundreds of people over these years. Ari's research, which was published in 2003, showed 90% of students were learning this way, and just last year, a new research study showed that 84% of medical students have done non-consensual pelvic exams on patients under anesthesia, and most without consent. So 20 years later, we see that unfortunately there has been negligible change. So this really underlines the need for state laws banning this practice. Massachusetts would be the 24th state to pass a law should you do so. Major professional organizations have made clear policy statements. They recommend that educational pelvic exams should only be done with specific informed consent and in situations that relate to the sexual or reproductive organs only. This practice has now been named medical sexual assault in the literature. In any other circumstance where a person's body was penetrated without consent while they were under the influence of a drug, it would be defined as sexual assault. In addition to pelvic exams, we know that non-consensual prostate and rectal exams happen as well, often to men. So this 2023 bill has been upgraded to apply to all intimate exams of people of all genders. And a Hastings report recently showed that Black patients are 4 times more likely to experience non-consensual exams, underlining that again, this is yet another health disparity issue that needs to be addressed. This is an egregious violation of patient trust and a misuse of medical authority to perform intimate exams on patients without explicit permission. I have personally interviewed many patients who suffer the same PTSD symptoms as someone who has been sexually assaulted. And moreover, they learn to trust their medical providers, that they cannot trust their medical providers, and they often avoid care because of this betrayal. There are 2,932 medical students at the 4 medical schools in Massachusetts right now. We know from a 2019 survey that Massachusetts medical students have been told to do non-consensual exams on patients by their schools. I want to recommend some improvements to the bill to make it even stronger so that it protects the most Massachusetts residents possible.
Thank you.
And I'll provide that to you in my written testimony.
Great.
Thank you for hearing me.
Thank you. At this time, I would call Rohini Kousalya Siva, and if I've said that wrong, please correct me.
Yeah, no, that's right. Rohini Kousalya Siva. Thank you so much for providing me this opportunity for a testimonial. I'm a recent medical school graduate, and I'm the president of the American Medical Student Association, representing about 30,000 medical students in the U.S. and globally. I wholeheartedly support H.2146 and S.1333 bill to prevent non-consensual intimate exams. Non-consensual intimate exams under anesthesia are absolutely unethical. It's our duty to transform the medical culture by championing ethical principles, informed consent, and patient-centered care. I'm thankful for this bill, and it is a step in the right direction. It's essential that education and training programs prioritize informed consent, patient autonomy, and education of non-consensual practices. Forcing students into these exams, driven by the fear of career consequences, inflicts moral injury, emotional trauma, and desensitization. I personally face the dilemma of being asked to perform intimate exams on anesthetized patients without proper consent, and I understand the fear and struggle of saying no to attending positions while explaining the ethical reasons behind my decision. The hierarchical nature of medical profession can discourage questioning any of these established practices, compelling students a lot of time to conform, which causes a lot of moral injury and guilt. We're seeing medical students choosing residency programs in states without abortion bans, and we will further see exacerbation of health professional shortage areas, especially in states with abortion restrictions. As more awareness is spreading, medical students will also not choose states that don't have bills to prevent non-consensual intimate exams. We want to train in states that support patients' rights, as well as our rights to speak up on these ethical matters. I want to say that I found the strength to speak up against this practice through organizations like American Medical Student Association and campaigns like At Your Cervix. I wholeheartedly endorse this bill. It's heartening to see that so many states are following suit, like 24th will be Massachusetts. The Colorado bill especially sets the gold standard for incorporating critical provisions. There's an inclusion of whistleblower protection, which is a crucial step in ensuring that those who raise ethical concerns are shielded from retaliation. Furthermore, explicit description of the consent process sets a clear standard, leaving no room for misunderstanding. The enhanced accountability and enforceability mechanisms is so important to create robust framework for upholding these essential ethical standards. I hope you will pass this bill favorably and encourage you to add whistleblower protection and clarity about consent to the bill. This is important for not only Massachusetts residents, but also for people in every state where Massachusetts students will eventually practice medicine in the future. Thank you so much.
Thank you.